What is ADHD? ADHD is the most common not neurodevelopment and hyperattention disorder in children, and it is also an autism spectrum. If early diagnosed, can be very crucial to help children succeed in their life and their academics. So over here are some examples that I see with my students that I work with on Mondays. Difficult paying attention and staying focused in tasks. That's number one for my class. Excessive talking. Another one. Frequent forgetfulness of losing things. We don't have that, but my son does. Trouble following instructions and completing assignments. We do have that problem in my class. Why is ADHD can be a problem? ADHD has a significant concern in the educational system due to the lack of resource for children with ADHD and those who has not been diagnosed. More than half of these children may fall through the cracks of the educational system. According to CBS, approximately 2.4 million children has ADHD, and around half of that number remains undiagnosed. Many parents do not know how to take care of the necessary steps to get their children properly diagnosed. So I do have a lot of parents that has their children come to my class and they have not been diagnosed, and I've noticed it, but I really can't say much to them or can't say anything. Okay. Prevalence in the problem and topic and minority population. So schools with limited funding may struggle to support students with ADHD compared to those with more resources. Research shows young non-Hispanic Black children are diagnosed with ADHD more often than non-Hispanic, with Hispanic peers. Children from low-income families also has a higher rate of ADHD diagnosed. Boys are more likely to be diagnosed with ADHD than girls who have symptoms are less noticeable. So for my daughter, she has ADHD. Hers is less noticeable because she's not very hyper. She's not talkative, but she does have ADHD. She's been diagnosed with ADHD. With my middle son, Anthony, he is very bouncy off the wall. He talks your ear off. And you could tell when you put both of them side by side, you would never notice that his sister has ADHD. You would compare him having more ADHD because his symptoms are more noticeable. How to support your child with ADHD. With the appropriate tools, ADHD can be managed through medicine or behavioral therapy. Parents can receive training in behavioral management if their child is younger than 6 years old. For children ages 6 years and older, they can begin medication behavioral therapy. Additionally, teachers can support students with ADHD by implements of a 504 plan that accommodates their schoolworks, thereby providing the necessary tool to help them succeed academically. It is important to consult your child's doctor for a diagnosis and to start receiving the necessary treatment. So for my son, he does have a 504 plan, and for him, he does have to take breaks when he's in the classroom, and they do have a special room, a sensory room for him. So if he is overwhelmed or he's just jiggly, then they could help him in that part, and we have accommodations for that. Okay. Conclusions. ADHD has existed for many years and still requires more attention to ensure children receive necessary resources. Increased education and donations can effectively support the children as they are important. They're an important part of the future. Parents should have access to medical help to diagnose their children as they can be expensive to pay for the tests and travel. More clinics could assist in diagnosing and providing medication and offering therapy for children to improve their lives. ADHD is a significant challenge that many people do not recognize. To get my son tested for autism, which was the same test price for ADHD. It costs us, with private insurance, out of pocket, we had to pay $700 out of pocket. Medicaid government insurance would not pay for it. So if we didn't have that insurance, we would have to pay over $900 to $1,000 just to get my son diagnosed with autism, and it would be the same with ADHD. And I hope you learn from my slide. Thank you.